Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. Today we're going to be going over a great exercise to help correct external hip rotation. That's where your leg or foot turns outwards compared to the other side while you're walking, standing, sitting, driving, or exercising. This is an essential component to relieve stress on the foot, the ankle, the knee, the hip, and the lower back. Hope you enjoy it. So external hip rotation is one of the most common postural problems that all people suffer with. It's where your leg turns outwards from the hip, causing your knee and foot to move outwards. This affects the way you walk, the way you stand, the way you sit. Many people sit with their legs crossed. That leads to this. Driving, one leg turns out more, typically the one that's working the accelerator. And of course the way you exercise, which then places abnormal mechanics on the ankle, the knee, the hip, and the lower back. Because when the hip externally rotates, there's a whole cascade of mechanical problems that happen, including the glute on that side becomes weak, the hip abductors become weak, the hip or the pelvic bone hip hikes, the ribs come in, the rectus abdominis, the obliques, the erector spinae, the lats shorten on that side as the rib cage and the pelvis come together. The opposite lat has a stress on it, making up for the weak glute that it attaches to. So there's a whole host of mechanical problems driving stress into the knee joint, the lower back. The foot actually causes pronation. Many times that's the reason why the heel starts bending down with walking, because as you walk, the leg's out, the inside of the heel hits first, and there's a rolling effect that causes pronation. So there's a whole host of problems that happen. And while there are many exercises to address each one of these components, today we're going to go over the hip realignment squat, which is a good basic core exercise that we use in both the Posture Size and the Pain Free and Fit programs to help people correct this tendency, get those hips a little straighter, restore harmony between the hip internal and external rotators, between the hamstrings, the quads, all these muscles where the lateral side starts overworking and the medial side becomes inhibited. So to begin, start with a normal stance so that the feet are facing straight ahead and the center of the ankle, the knee, and the hip are all aligned. Engage any correction or RPI, reverse posture isometric, that you've found about your body, meaning correcting mechanical and postural alignment distortions. If you haven't done so, go to the Pain Free and Fit website or the Posture Size website. There's a free body analysis there where you can check out your own mechanics and stability and learn where your distortions are so you can get them straight before you do any exercises. Otherwise, even with this exercise, you think you'll be correcting yourself, you'll actually be creating more dysfunction. You'll be strengthening your abnormal mechanics if you don't engage all your corrections. So go get a good body analysis on either of those websites or through a good healthcare professional who specializes in body mechanics and posture, and figure out how to create harmony and balance in your musculoskeletal system so you can have the good effects of exercise. So once we get all those RPI corrections engaged, whatever it is, tail under, shifting your shoulder, rib up, engaging your multifidi, inhibiting your internal oblique, whatever it is, you get those all set and you bring your leg that's externally rotated, let's say it's my right side that likes to turn out, we're going to bring that leg about an inch back compared to the other, and we're going to turn the foot in, as well as the hip, about a 15-degree angle, okay? That's reversing all the mechanical stress. That now, in that position, is starting to stretch the external rotators of the hip, the ITB, the vastus lateralis, the lateral hamstring, and as we squat, it's going to naturally start to recruit or wake up the opposite or inhibited weak muscles like the medial hamstring, the hip internal rotators, the VMO, okay, of the quads. All those will start to be gradually awakened or recruited. And that's a big part of turning that leg straight and getting your mechanics straight to reduce the stress on your knee, hip, lower back, foot, ankle, and bring balance back to your musculoskeletal system. So once we have that engaged, we're going to check our core, meaning we're going to make sure lower tummy is in, spine is tall, bracing the abs like we're getting punched, and we're going to slowly sit back into a squat. As I do so, I'm making sure that my knee on this right side is facing the same 15-degree angle that my foot is. This knee is facing straight ahead following the foot. This side, we want to make sure that it's facing in 15 degrees. That's going to help reduce any of those knee rotation postures that put a lot of pressure on knee meniscus and patellofemoral problems. Because if you had your knee straight, that's torquing the knee joint, putting a lot of abnormal stress. So make sure that's going to follow the toe the whole way through. As I'm down, I'm also going to make sure that I'm avoiding any pronation or supination with my foot. And I'm going to make sure that that hip on the side that the leg is turned in on is not hip hiking, is not coming up. I can put my hands on that top of the pelvis and check to make sure that we're straight. As I come down, I'm also going to make sure that that thigh bone, the femur in the hip socket, is forcing back in the hip socket, recruiting the glute, because another tendency with this problem is that there's an anterior translation with that hip that comes forward. So if you put your finger on the side of your hip, you'll feel that hard bone. Put one finger behind, you want to push that bone back into your finger. That releases the typical overusage of the hip flexor with this squatting exercise and starts to recruit the glute, which is weak on that side that the hip is turned down on. You also want to make sure that the pelvis is straight. Typical problem with people that turn their hip out is that pelvis likes to roll away the other side or rotate. So we want to make sure our pubic bone is facing straight ahead, which means I need a little tension turning it to the right into that leg to keep it straight. I then squeeze the buttocks together and come back up. So that's the repetition scheme. We're going to start with 1 rep and we're going to continue that good posture as we go down through several reps. And your speed is just a normal cadence of about 1 to 2 seconds down, 1 to 2 seconds up. I'm focusing on all these points, making sure the knee is in good alignment. If I have a weak VMO, of course, I'm going to be tensing the kneecap in. We have another video that addresses VMO function and kneecap tracking disorders. You can look at that. I'm going to make sure my hip is sliding back in the socket. I'm going to make sure I'm squeezing my right buttock harder than my left because that's going to be the weaker one. Again, if I have overactive back muscles, I'm going to keep a little tail under tension to release the erector spinae back muscles, and that'll help me focus on recruiting the glute and getting more squeeze out of the buttock. So as I'm going through here, I'm strengthening the weak buttock. I'm strengthening the medial hamstring and quads. I'm strengthening the adductors on this side, and I'm stretching and relaxing the lateral quads, hamstrings, ITB. Right? We're creating balance in this one exercise, both strengthening the weak and stretching the tight, so that after 20, 30, 40, 50 repetitions, when I get done with this hip realignment squat and I relax, I'll notice that as I walk and stand, my leg will naturally want to come and be a little straighter. And that's going to create normal mechanics throughout the entire lower extremity and back, relieving stress and pain. And you'll be able to exercise whatever you're doing. You're squatting, you're lunging, you're participating in a dance class, you're in your CrossFit class, you're doing Pilates and yoga. That leg will have less of a tendency to externally rotate. You'll be strengthening more normal function throughout your musculoskeletal and kinetic chain, and that's going to decrease your chances of pain and injury and increase normal mechanics, normal usage of the buttocks. If you're a sprinter, you're going to run faster. You're going to have more power production out of your glutes during both hip flexion and hip extension. If you're a lifter, you're going to have more power production out of your core, out of your lower extremity when your leg is straight compared to the other side. Abnormal mechanics decrease athletic and force potential. They also increase chances of injury. So this is a great exercise that can be used as a warm-up before any exercise you do to start a normal hip rotation pattern and keep you pain-free and fit. Enjoy.